But
I think we should get started. I see it's 2:30. So we will hopefully let the final panelists join us while we get started. Greetings, everyone. I know this may be morning for some of you, afternoon for others, and evening for others. Nevertheless, greetings. I am Joseph Arik, the Executive Chairman of ID for Africa, and I'll be moderating this exciting session on the impact of COVID-19 on identity management in Africa as seen by the identity authorities or the identity stakeholders. I'd like to warmly welcome all of you to this webinar series that we have started. We have actually, in addition to this seminar today, we've announced 2 more coming up in the future. One is on the 17th of June, which will feature a lineup of the leading development agencies, and they will give the perspective of identity for development and the impact of COVID on the development agenda. Then on the 26th of June, we will have a session which is the industry perspective. We've done a request for proposals last week to all the industry, and we said if you have any interesting ideas or innovations which show how innovations are responding to the crisis, the pandemic, and what would be the innovation landscape in a post-COVID era, we will be selecting that sometime next week, and we will be selecting 7 of the top proposals. We've been getting a lot of proposals, and I think it's going to be an exciting session as well. So please mark your calendars in addition to today, the 17th of June and the 26th of June, and it will be exactly the same time as the start of this seminar. I want to emphasize that this is not a replacement for our in-person annual general meeting. Nothing replaces that. Nothing replaces that intensity and energy and the intimacy of the discussions that happen when you bring in 1,500 people in one room. So we do miss that. But we permit ourselves to have this discussion as a webinar on Africa online because we think Africa is in our DNA. Africa is in our name. We've come from Africa and we intend to go back to Africa. So, but please do not think that because we're holding something on Zoom that we have abandoned Africa. We will be there. Anybody can hold anything on Zoom from any region and pretend that they are speaking for Africa. We're not. We are coming to you from Africa, and we will be inviting you back to Africa. And so, however, we had to do this. In fact, this week would have been the meeting, the annual meeting as originally scheduled. And so we cannot wait until we see you again, because the topics are becoming more and more urgent. And we want to use this opportunity to continue the engagement with our community, which we miss terribly. We really miss you. And want to let you know that in these times, even when we are apart, we stand together. And so I want to say a few words about when we think the face-to-face or the in-person annual meeting can take place. As you know, this was scheduled for this week. We moved it to October of 2020. Given that the world is recovering, however, not fast enough, and also the airlines and the restrictions on gatherings of large scale were unlikely to be lifted, we believe that it is unlikely that we will be in person in 2020. So, however, you have my commitment that we will be meeting in person in 2021. We have put together a safety plan, which we shared with the government, and we will be discussing with the government of Morocco, which is the host, how we intend to conduct the session safely and effectively. But obviously, we have to be considerate to their requirements, the Ministry of Health's requirements. So we're busy working on all the details. So stay with us, stay tuned. I use this opportunity to thank all members of the community, whether it is the governments, whether it is the development agencies, the foundation partners, the Gates Foundation, Omidyar Foundation, the development agencies such as the World Bank, UNICEF, UNDP, the Center for Global Development, and also the exhibitors for all their solidarity, for realizing that we are not ever, under no other time have they expressed this type of solidarity, which gives me hope and excitement that we're going to come back together. So I thank everybody for their solidarity, their enthusiasm, and their appreciation. And I think we're learning a lot now that we're realizing that our mission is going to be even more important in a post-COVID era. It's going to be a mission of giving digital identity for all, because the recovery is going to rely on the presence of infrastructure, and infrastructure needs digital identity to empower people, to empower economies, and to build social safety nets that are going to protect those vulnerable and protect the risk against the risk of some other pandemic that might happen. We've seen the future, and the future has risk. And as a result, we can no longer go about our daily business thinking that we cannot build contingency plans for that risk. So our mission remains viable, and our enthusiasm for that mission and our commitment for Africa is more than ever is there. So don't want to delay this anymore. I want to thank the panelists who have joined us, and I see now William is joining us from Port Louis, and so the panel is now complete. Thank you all for taking the time from your busy schedules to come and share with us some of your thoughts. This is a very interactive session, so there will not be any presentations, but there will be an opportunity for in-depth discussions. So to kick off the session, I will ask the panelists one by one to present themselves, to say who they are, their organization, and their country. I'm letting them do that themselves because those who are entering the attendees from a web browser will only see the person who speaks one at a time, while the others from an app can see the whole panel. So I let them say that, and then we'll come back and we'll pose our very first question. One more comment. For those who have submitted questions, we have received over 150 questions. So we're going to try to answer them in bulk, in thematically. But if you want to ask questions, you can still ask questions, but try to make sure they are very, very particular to what's being said at the moment, because so many questions have been asked in general about other issues, and we're going to try to get to them in this hour and a half. Okay, so without any further ado, I ask the panelists to present themselves, starting with Nigeria.
Okay, good morning, good afternoon, and good evening, everyone. My name is Aliu Aziz. I'm the Director General and also the Chief Officer of National Identity Management Commission in Nigeria, in charge of the identities in Nigeria. Thank you and welcome to the webinar.
Kenya.
Thank you. My name is Ruben Kimodo, Director, National Registration Bureau. The National Registration Bureau is in charge of processing of all identity applications and the issuance of identity cards to all the Kenyans 18 years and above in the country. Thank you.
Guinea.
Good day. My name is Maury Camara. I'm the Managing Director of the National Agency of Electronic Governance and Digitalization of the State in Guinea. Welcome to the webinar.
Uganda.
Good day, everyone. My name is Grace Nanyanzi, and I'm the Manager Information Systems. I'm from Uganda, and I work for National Identification and Registration Authority.
Ethiopia.
Hi, welcome everyone. This is Yoda. Yoda is Mikael from Ethiopia. I work as a technical advisor at the Prime Minister's office. I'm also part of the nascent national ID team. Thank you.
Mauritius.
Good afternoon, everyone. I'm William Ayo Ayinu. I'm the Registrar of Civil Status Office here, and the core activities of the Civil Status Division would be the declaration of birth, registration of birth, celebration of civil marriages, registration of death, annotation following marriages, change of name, divorce, adoption, etc. We are also in charge of the National Identity Card system and also the Muslim Family Council, which is a council set up to register Muslim religious marriage and offering also services in terms of conciliation. And the Civil Status Office falls under the umbrella of the Prime Minister's Office. Thank you.
Thank you. And last but not least, Senegal.
Thank you, President. Good morning and good afternoon to everyone. I'm Mohamed Mahi Saif in the National Universal Healthcare Agency in Senegal. We are in charge of offering to poor people and disadvantaged people risk coverage in the system we have developed in Senegal, which cover each district with around 671 insurance schemes in rural area and district. Thank you.
Excellent. So now that you've seen the range of the representation that we have of the identity stakeholders, I would like to go back to the panel and ask a panel-wide question, which is essentially to give us in a summary, in few minutes, 2 minutes tops, just the situation analysis on the impact of COVID. To what extent has COVID-19 impacted their countries, and what is the current status? I mean, we're just giving you a situation analysis so you get a feeling for what's happening, and then we go back into more details of the impact on identity management and the changes and etc. So back to the panel, and starting with Nigeria, to what extent has COVID-19 impacted your country?
Well, thank you very much. Well, COVID-19 pandemic resulted in lockdown of the country, cancellation of gathering, public activities, closure of schools, airports, restrictions on the interstate travels, etc. It affected Nigeria in all of the areas you mentioned and further exposed the inadequacies in our healthcare system. The need for us to also ramp up the identity registration to support social welfare and also the benefit disbursement. The multiplier effect of poverty and hunger as it relates to security of lives and properties, and the economic impact of being a consumer nation rather than the producer of oil that we are meant to be. So we look, the numbers are still rising. We have not yet reached the peak, but it's not as bad as in Europe or America. So we hope for the best. Thank you.
Thank you. Kenya?
Yes, the epidemic has had a major effect on this country in terms of the way of life, business, government functions, and in actually our spheres of Kenya's way of doing things. When the first cases were detected in Kenya, the country did put up quite a number of measures to try to control the spread of the disease. Some of the measures was immediately, because most of the immediate cases in Kenya came from travelers who are coming from outside, especially from China, UK, USA, and UAE. So the airport was closed to all international flights except for cargo. Then thereafter, we also closed the airport, our airports for mixed travel. Right now, we have a curfew in Kenya from 7 p.m. to 5 a.m. in the morning. And that's impacting heavily on the way Kenyans conduct business and with their life. In terms of work environment, Kenyans have been encouraged by the government to work from home, those who can work from home. And even for those who can work from home, a lot of premises have been closed. Hotels, bars and restaurants have been closed. Okay, last week there was some partial opening to a few of them, but majorly a lot of them are closed. They're impacting heavily on employment of those Kenyans who have been working in that sector. In terms of closure of movement, Nairobi, which is our capital city, and Mombasa, they have been locked down. You cannot move out of Nairobi and Mombasa to the other environs. Again, we have also closed some closure in some of our counties, which are neighboring our neighboring countries like Somalia, especially Somalia and Tanzania, where we have had quite a number of cases. So there is a major impact on this pandemic in Kenya.
Okay.
I cannot say the Kenya has not really received a lot of cases, because right now the cases we have had who have tested positive by yesterday was 2,093 out of testing of 82,900. Maybe it will have increased by today, and we have had 71 deaths.
Okay.
We have had 42 recoveries, which is quite encouraging to a lot of people. But what I've witnessed is that while there was a lot of anxiety and worry amongst Kenyans in the initial days, as time progressed and people got used to the pandemic, there is a feeling of people wanting to get back into business, because they find it is really impacting heavily on the way that we do our things in this country. Thank you.
Right. Thank you. Guinea?
Thank you. So like many other countries, we've been affected tremendously on the economic side. On the health side, we have few deaths, right now about 23, saying that any death is very difficult and hard. I don't want to minimize that. But out of a total of 3,866 cases, we have 23 deaths and 2,267 in recovery. The impact that the pandemic has had on our country, sadly, it's affecting the poorest the most. We had a number of initiatives in place at the beginning of the spread of the virus that had to slow down a little bit. So that affected the identity related entities in Guinea who were trying to identify and assist those poor. In any case, the government took a number of measures to stop the spread, good hygiene, washing hands, wearing masks, confinement, social distancing as well. But in our economies, people have to go out to make a living. So we can assume, we can say that so far, we managing, but the economic impact is great. Another point is, at this stage, everything that has been done has mainly been done through the efforts of the government. There's a lot of help and assistance coming on the way, but I would say the main impact right now has been economic. So I'm not going to take too much time. I'm going to pass it on. If there's any other question, I will answer at that point. Yeah. Thank you.
We'll come back. Uganda.
I think just like any other country, COVID has affected us. We first got our first case on 21st March. Right now we have around 500. Luckily, we don't have any deaths, and we thank God for that. We only have 283 active cases. So the rest have recovered. And so, of course, it has affected our economy. By now, we should be, we had expect to be growing at 6%. It has come down to around 4%. So we've been in a lockdown for the past 2 months. It's now being eased out. Private transport has been opened, of course, with few restrictions to be able to achieve social distancing. Public transport is expected to start tomorrow with a number of guidelines. So our president has really been key in fighting this, and I think the public is listening and learning to follow the guidelines so that we avoid the spread of this. And luckily, we really don't have cases in the community. The cases we have right now are coming from our neighboring countries, because Uganda being a landlocked country, we depend more on Tanzania and Kenya to move goods. But we are managing.
Thank goodness. Thank you. Ethiopia.
So just like the rest of Africa, fortunately we've been shielded from like the pandemic scale we're seeing in Europe and the US. We have so far tested, the Ministry of Health has been expanding its capability in testing, and they have so far tested 120,000 people, assuming the Ethiopian total population is between 100 and 120 million, 0.1% of the population. But anyone who's deemed at risk, who is a recent arrival, who has had contact with a recent arrival, or who's showing symptoms, usually gets tested. So total test is 120,000. Total confirmed positive so far is 1,200. And unfortunately, there are 17 deceased so far. As Maury from Guinea mentioned, there is emergency law in our country, and people are told to stay home as much as they can. But the reality in Africa is that a lot of people had to go out to make a living, and people cannot basically stay home for weeks on end. So that's one of the difficulties.
Thank you.
Facing another thing, as a personal note, is we're just starting the rainy season in Ethiopia specifically. So we're going to have 3 more months of cold. So it would be an interesting.
Okay. I think we may have lost your audio at the end, but Mauritius?
Yeah. Yes. Well, our case is somewhat similar to other African countries. We started with the curfew and the lockdown and the confinement on 20th March, because we had one case that was imported, and we had about 300 cases.
For the other speaker, can you put on mute until, because there's an echo?
Yes. Yes.
Yeah,
unmute. Sorry.
Continue, please. William, you are on mute. Continue. Unmute yourself. Unmute yourself so we can hear you, or did we lose you? Maybe while William is trying to get back, Senegal, could you step in? Oh, William's back.
I'm back. Okay.
Yeah.
Yes. Okay. Thank you. Yes. So I was saying that we had about 300 cases, out of which we had 10 deaths reported, and as at date we have only 3 positive cases. These people are at the hospital, and we have passengers coming to Mauritius who are in quarantine. This is the current situation as far as the COVID is concerned, and the effects are also same as in other countries. So we have all the public sector and the private sector both were closed. People had to go to supermarket with protective equipment, and then in alphabetical orders, so twice a week. The economic condition is somewhat difficult, as in most countries, but government has been helping a lot people. Government came with a wage assisted scheme, whereby it helped to pay the wages of those working in the private sector. For the public sector, there was absolutely no difficulty. So what government has done, government has disbursed the sum equivalent to $173 million to help public sector to pay the wages of their employees. And then we have also raised a COVID fund, national fund. And to date, we have gathered $4.1 million US. That sum will be used to help NGOs, enterprises, and people who are at grassroots level. And the Bank of Mauritius also has injected $150 million US in the budget. We are voting our budget tomorrow itself. So money has been injected in the national budget to give a boost to the economy, to help the sectors who have been affected by the COVID. It's about in brief. Later on, maybe we can develop more.
Yeah, thanks, William. Mohammed.
Thank you. In Senegal, like the other country in Africa, we was also really affected by the pandemic, economically and socially. Today, we have 3,932 cases of infection on coronavirus. And 2,063 people was recovered. And we have 45 people who died from the pandemic. The government decided recently a relaxation of the state of emergency. We have adopted a new strategy to live with the pandemic, to adopt our life to live with the pandemic. And some measure, the government decided to allocate 1,000 billion of CFA to support affected sector, like private sector, and also poor people. Government has dedicated food distribution for 1 million family in Senegal. And in the meantime, we have make a constat that sector which was specialized on food delivery and good delivery worked well during this period. And globally, that's the situation actually in Senegal. We have a new strategy to now live with the pandemic, with a relaxation of the state of emergency.
So, as you could see, we've heard from all 7 panelists, and the repeated theme has been that the coronavirus had a major shock economically, major impact economically. And clearly, when somebody says major economic impact, it means vulnerable people who are already being excluded because they're not yet in an inclusive system or being out of the system are going to even be more disadvantaged. And therefore, we, as Mohammed said, as a community, we have to figure out how to get back to work, how to get back in the field, and how to live with the pandemic. So I want to get concrete, I want to get technical, and instead of asking the full panel, I'm going to throw in a couple of questions which were asked by a lot of people, and they have to do with the fact that all countries have adopted social distancing as an effective measure to live with the pandemic. And when somebody speaks of social distancing, there are certain constraints about ID systems. So I'll ask you as panelists, can you conduct enrollment? Can you conduct authentication? Can you conduct collection of data in the field while maintaining social distancing? Even the images we have in mind when we see elections, very long lines and people stacked ones against the other. So anybody that has any plans, any experiences, any ideas, please raise your hand so I can recognize you and I give you the opportunity to speak about how do you reconcile social distancing with the fundamental functions of identity authorities that need to touch people. Nigeria, do you have any? We can start. Anybody?
So
yes.
the problem is not the social distancing problem. I think the fundamental problem is in Africa, the technology we use is generally we use fingerprint identification. And fingerprint identification means contact with the sensor. And the global problem is in the case of COVID-19, how we're gonna continue to use fingerprint identification, and what kind of measure we can take to be sure that there will not be a case of contamination.
Yes.
Because it is a contact, we have a contact on the teapot. In our case, because we are concerned on identification in health facilities. Generally, people who come to authenticate themselves in the health facilities are supposed to be sick. So if they are obliged to use the fingerprint identification to authenticate themselves, there is a risk of contamination because every people use the same sensor.
Right. So what do you do?
Clean do we need to have someone who is beside the sensor to clean every time we have to authenticate someone? That's the question actually we have to face. There is the same in my offices. We have fingerprint here for people to check. People have to authenticate to come in the office and to go outside the office.
Take a pause. 1 second. Take a pause. I want to hear Nigeria's reaction to this, because we heard that all biometrics in Africa is relying on fingerprints, and fingerprints are touch. So one idea is, are we going to need to clean, disinfect? And the question is, can we trust this process? Can this be happened in a systematic way? So Nigeria, do you have any perspective on that?
Yeah, I believe that we have to adopt the cleaning before the use of the fingerprint machine, and also cleaning after it, while we look forward to having some other biometric models to implement. Like at our back end, we have the 3 models of the fingerprint, face, and iris, but we have not been capturing data on the iris. So this is an opportunity also for us to also introduce the iris. But we need to keep the 2 meters apart guidelines for queuing at the centers. We have to restrict number of persons that are allowed into the center at a time. We also have to space out seating arrangements, also for even our staff too, to be on shift, not to cram the office. And then we also have to encourage people to use the pre-enrollment portals, so that it will reduce the time when they come for the biometric capture, and also to implement some of these online appointment booking processes. But the fingerprint will be with us for some time. It cannot change immediately. So we need to take these measures of disinfecting it, the scanner, and also cleaning it before and after, and making sure that all the COVID-19 measures are also taken into place. Thank you.
So let me ask specifically another identity authority what their plans would be. What I heard is, yes, it would be nice to have contactless, but the fact is we are, for a transition period of time, we are going to still be using contact fingerprints, so we have to live with it. So what do we do? So Ruben, what is your view about the future of contact fingerprints? Do you think that's going to be obsolete in 5 years? Or do you think we can live with pandemics and touch fingerprint in using measures such as Mohammed and Ali Aziz have explicitly said.
Okay, if I may comment on this one, the epidemic has really impacted on registration activities in the country. We are in a position where we had semi-automated registration systems, where we were capturing the road fingerprints, which required the personal contact between the applicants and the officers. And we had to suspend that immediately when the epidemic came into this country. And right now in the country, we are only issuing identity cards. Maybe on the positive side, in Kenya, the M-Pesa system in terms of transactions, which uses
Mobile
the ID, the ID documentation, has gone a long way in slowing down use of physical money. And again, when it comes to use of the identity documents, we have an e-citizen system, whereby, by the way, 98% of Kenyans own identity cards, because by law, you cannot do anything in Kenya. You cannot get into any transactions, whether government, whether business or commercial, without an identity card or social. So we have migrated our data to an e-citizen platform. E-citizen platform is whereby if somebody is applying for a passport or somebody is applying for other services, you just log in and you can be able to migrate and be authenticated using that system in terms of your data. So that's already an advantage in terms of Kenyans who are already enrolled.
But hold on, Ruben, you said you moved them to an e-citizen platform and they can be authenticated. So you have an authentication model, but it still uses fingerprint, no?
Yes, it's the use of the identity number, not necessarily that you're using biometrics in terms. Yes.
Okay, so it's a digital identity.
But, yes, digital identity, so sort of. But we are also at a very advanced status where we are come up with our own specifications for an electronic identity. And then now with the epidemic, with this disease, we are also trying to see whether we can be able to refocus those specifications so that they can be able to be tailored to react to that the problem we have now. Because we find if you have to have an idea, you have to have physical interactions and others. It will go a long way, not limiting the spread of the disease. Otherwise, right. For purpose of identification and registration, we also plan to have live capture systems in our county headquarters, so that we are going to limit the interaction between the applicants and also the officers in the field. For purpose of putting up safeguards for those emergency cases, like having facial masks, like having detergents and all that, I think we as a department, we have already bought that and supplying to the officers.
Okay, so let's assume that we need to live with fingerprints in a transitional period or for a long time to come, and we have to trust the sensors because we have to build in place some sort of disinfection and cleaning mechanism. But how do we ensure that some center somewhere in some remote area, which is not directly under your control, will be following the standard of cleaning? Do I trust as a citizen coming to the center, do I trust that they've cleaned it the way it should have been cleaned? Or can I take something into my own hands, no pun intended, and try to deal with the situation? Actually, I wanted to give the opportunity for Grace to chime in on this area, because I think we seem to be converging to the notion that yes, we would love to have contactless, but the fact is fingerprints are what we have today, and fingerprints will be for a while what we need to do. And so we gotta clean, we gotta disinfect, we gotta do what it takes. So Grace, do you have a perspective?
Yes, and yes, we have to clean, but also I think we have to plan and have proper guidelines. Were the first one of the first services to be closed together with the schools due to the numbers we have in place. So we have plans to reopen, but you have to limit how many people come to the registration center through the appointment system. But even as you limit, you have to make sure that not only have you cleaned your machines, the people themselves are clean, because there is this closeness. They must wear the masks, they must follow the guidelines. And I think communication also, the public has to know the reason why these measures are being followed. And I know we still use the fingerprints and so on, but I think we also have to aim for digital identity. The agencies that we so far connected with, as integrated with, that use the national ID, continued operating throughout the lockdown. They really didn't, actually, some of them, their businesses went up because all you needed is to go to their online sites, key in your national ID number, and you get a service. So there was no contact needed. Our telecom industry made more money because people were using more of the online services. And so we needed to aim at having to move to the digital identity, so that at least the records we have, such people are able to transact going forward as we look what to do with the incoming records.
Right. So you have the digital identity, but I assume that the authentication is a soft authentication. All you have to do is submit your demographic. You're not actually authenticating through any biometric, or are they authenticating using a selfie? So there is no authentication. Soft.
There are some, we have different ways. There are some where you just submit your biodata and then we verify and because we have a law that allows us to share information. So once you enter your national ID number, the person offering a service is able to compare the information submitted to them and the one in the national ID database. So they are able to do this without contact. However, we have others that where you need to authenticate, where you need to do this, but so those were affected kind of. So they have, of course, they didn't stop, but they have to do more cleaning to follow the guidelines as stated by Minister of Health.
Great. I wanna hear Yudehi on this subject, but hold on the thought. You know, when we talk about fingerprints, we assume that the fingerprint is touch fingerprint, but there's a whole class of new technologies, new sensors, new algorithms where you take a photo of the finger or multiple fingers. So these are, you wave your hand or you present it in front of a sensor or scanner. So the panel, please think about that modality, if it's viable for Africa or not, while I go to Yodehi, who I know wanted to give his perspective on how do we open up the work or the business of the national identity authorities during this pandemic. Yodehi, I believe you wanted to say something.
Yeah. Yes, I actually wanted to add on this issue of contacts versus contactless biometrics. We in Ethiopia here are in the process of launching a pilot. So we're more concerned about enrollment more than authentication. The options are still, all of them are on the table. There is contactless authentication technologies we wanted to test for the pilot. We've heard about a lot of different kinds of technologies. We've heard about voice recognition or facial or gait recognition. All of those are biometrics. And since we are at the start of the pilot, we are open to test all of those to see which one is feasible. But principle-wise, we're going for an authentication. For an enrollment that's biometric based, but not necessarily for authentication. We wanted to minimize biometrics for authentication. We wanted to focus on OTPs or soft authentication or other technologies and avoid biometrics because it's an overkill for in terms of facilities and logistics required. And for many services, it's an overkill to have a biometric authentication. And that's the principle we're having for the pilot as well as for the main launch.
Okay, so another question I'm going to ask, I'm going to do a poll after we come back to the question of the essentially the touchless fingerprint. I want the panel to think about the following statement. In 5 years, all identity databases in Africa will include face, finger, and iris. And we're going to vote on that after we come back from this question. So the question right now is, does anybody have any opinion about touchless fingerprints? Do you have any experience? And that already in itself is an important statement. If you don't have experience with them, that means that the industry has not been vocal enough explaining what they do, and etc. And we need to be looking at that. Does anybody have experience with touchless fingerprints within their context? Maury, do you have any experience?
No, that was my point. We don't have any experience, but the COVID-19 is going to change the landscape forever. So I think there will be pressure on the providers to come up with solutions that address this type of situation in the future. It's very likely that every 4 or 5 years, we're going to run into this type of pandemics. So I believe the market and technology will adjust to the new reality we're going to be in. So even though we don't have experience in it, I suspect that in 5 years, there will be technology, if there's not already some existing, that will allow for contactless enrollment of biometrics.
So you think the pressure is real? To get away from contact is real in Africa?
Definitely. When you look at SARS, you look at COVID-19, the consensus is we're going to have to learn to live with those type of health issues. We hope not, but they will adjust, they will evolve. So it's apparent that every 5, 6, or 10 years, we're going to run into this. We're going to have to adjust, such as in the past, a number of crises or events have forced us to change our habits and ways. I think it's going to be the same way here in the biometric community.
Okay, I want to go to Mohammed, and then I'm going to ask a couple of questions. So Mohammed.
Okay, here in Senegal, we have a pilot to implement face recognition as an option if the fingerprint authentication does not work, because in rural area, we have a problem of quality of the fingerprint. Many people does not have a good fingerprint, so that's why we have bought some tablets which implement the face recognition, and we do it as an option. If the fingerprint authentication does not work, we have the option to authenticate the face.
But on a large scale, if we assume that now everybody goes face, do you think you have the accuracy enough for you to handle the scale that you need?
Actually, the system we have is enough to use, because in our card, in all the ID card, you have the picture, you have the face, you have the picture of the user, of the beneficiary. Right. That's why it is easy to implement the face recognition, and we have tested it in our tablet, and it is working well.
And any interest in iris?
Not iris yet. Not iris. Face recognition.
Face recognition. Let me ask William. William, what does Mauritius do when it comes to biometrics? What are you capturing? What are you continuing? What you're discontinuing from the enrollment?
I couldn't hear what you said. The national identity card system, we do it the traditional way, that is taking a fingerprint. We do not have facial recognition, no facial recognition, no iris, because we had court cases. Yes. And then even if, when we take the fingerprint, after processing the application for the national identity card, we have to delete the fingerprint. We only keep the minutia. We only keep the minutia. Yes, yes.
That's the point that I wanted to hear and raise with the panel. I mean, in fact, we talk about COVID forcing us to move into other modalities, etc. But in many countries in Africa, they don't have the law that would permit the extraction of facial templates that do one-to-many. They may do one-to-one for authentication, but one-to-many may give people a little bit of concern about privacy, about surveillance, and then under the guise of COVID-19, maybe people get concerned that you're letting in a capability that is very invasive to privacy. That's a perception. So maybe that's a topic that's worth bringing back to the identity authorities, maybe Nigeria. I mean, is there any legal framework that would protect against facial surveillance? Because now you've got face recognition and you've got face templates that can do one-to-many.
Well, thank you very much. You know, when it comes to selection of the modalities, also the population also matters. That is why we have selected 3 models from the time that we were designing. So at the back end, we have the fingerprint, we have the face, we also have the iris at the back end. But we are capturing only fingerprint and face. We have not yet started capturing the iris. But with the COVID and also the need, as our population is growing very fast, we need to introduce the iris and also introduce other measures. But when it comes to the data protection, of course, having a national data protection law and framework that will help countries and societies develop policies that will work for their population is extremely very critical. In Nigeria, we have not yet gotten the law in place, but we have regulations from IT authority, NIDA, which is being implemented now. So these safeguards often when it's required, it will protect people's right to privacy with stringent data governance rules that can also affect how government responds to pandemic. The question we should be asking ourselves are, how can we make use of personal data for the greater good while still protecting the individual's rights to privacy? And to what degree should privacy and other rights be curtailed for the sake of public safety? I don't have all the answers, and I understand that these are discussions that we need to have as we pick the pieces of the havoc and also the health and also the economic downturns of the pandemic. So we, in terms of the selection of biometrics, is based on the population and also accuracy that we want to have in the use of the data in future. That is when you do authentication in future. And we are also working towards having that data protection in place. We have seen places like Singapore and South Korea, how they applied during the pandemic, how they applied those technologies to really trace people, which some people might say privacy or whatever, but during pandemic, nobody everybody wants to be protected rather than talking about this. So sometimes it's public good. Thank you very much.
So looking at the panel, please raise your hand if you have a data protection law in place today. So we have 1, 2, 3, 4, 5. Mohammed, you raised your hand, right?
No.
No, okay. So there are 5 countries out of the 7 that have data protection laws. Nigeria will have the data protection law, I understand, in the next 6 months.
Yes, hopefully we will have it in the next 6 months.
Next 6 months. Okay, so
hopefully we'll have it in the next 6 months. Thank
you.
So
what we've learned from Mauritius is that, yes, while we have fears about contact fingerprints, they are the only ones that are covered by the law, by framework of protection. I asked William, do you feel there needs to be a revision in the law to allow for more permissive biometrics, such as face, or do you believe that the concerns about privacy outweigh the concerns about cleaning, and that you're going to continue to do cleaning?
Yes, this doctor. Just to go back a bit first, let's say we are taking processing application every day since the confinement has been waived. And after each operation, there is disinfection. After each person who comes, when we take his fingerprint, the screen is being cleaned after each operation. So, the officers have got protective masks, and then the public also. Everyone who comes needs to have his mask. It is the same as in many countries. But there has been resistance as far as facial recognition, fingerprint is concerned, because people fear that sometime, then in some cases, their data can be used. For example, the politician, the opposition. Sometimes the fear was that if we give this to the police, or we give this data to the police, this can be used against the citizen to track down criminals. And it was not the purpose. When the data subject gave his details, it was not for that purpose. It was only to process his national identity card. So it's a bit of fear. People apprehend that although Mauritius is a democratic country, very democratic with all the Westminster system and the UK, but still there is fear in the population for political reason, for personal reason. Some would say that their biometric, their figure, their face is personal to them. Why to give it to the authorities? So there has been some resistance so far.
Okay, so I mean, obviously we live in a society where we have 10 fingerprints, we touch things, we cannot be completely going around without touching. So we have to live with a pandemic where we touch things. So that's clear. So what about a model where for enrollment, since it's supervised and there is an agent who's trained, who's responsible, who's wearing a mask, who's with a cleaning happening. I understand that fingerprints can be salvaged for enrollment, and because they're the best, they've got high accuracy, they've got good stuff. What about the new normal for authentication? Because we can't afford to have like fingerprint sensors at the doors of access control, or some areas where it's the e-gates or whatever, because they're not attended. So unattended authentication. Does anybody from the group have any idea? Maybe we can hear from Ruben, Mohammed, Mori. Do you have any ideas? Grace, any ideas of experiences with authentication and touch? How do we make that happen? Cleaning is not going to be an option because we don't know, unless I carry with me a spray and every time I want to enter my building. What do you do? Enrollment, I grant you that.
Okay, one of the major problems Kenya faces in terms of identification is stemming out illegal registration. because you have a lot of communities, especially those ones which overflow our neighboring countries, who try to infiltrate in the country and would wish to be registered as Kenyan citizens. You also have Kenyan locals who would wish to manipulate data for various reasons. So the fingerprint plays a major role, and it will continue doing so for quite a long time to come. But in this country, we are also coming up with a program where we want to align identity movement to civil registration, where we are trying to integrate the two systems for purpose of starting having a unique, and we are at a very advanced stage of capturing births in this country and also digitizing the births so that the two systems can be interlinked, and then eventually we issue a unique number, which we are calling a Huduma number. Our thinking is if you can identify individuals array and have them in a database, and they issue them with a unique number, which we are calling a Huduma number, then you might find that the role of biometrics could be reduced. Because you could as well identify applicants, individuals using a mobile ID by issue of the number. As we speak now, in Kenya, there are a lot of services which Kenyans are able to apply for, and they're able to be processed without the necessary use of the biometrics. Just by use of the identity card and maybe recognition of the number and checking into the database, and then identifying, trying to identify that the person who is before you applying for a driving license, applying for a KRA. KRA is our tax authority, and all those other services, when they present themselves having the identity card, and just by checking at the photograph, you're able to say, yes, this is the person before me. Okay. So I think mobile identity will play a big role, but we're required to capture people array, come up with a family tree, and use the unique number as a form of identification.
I want to come to you, Dehi, because you raised your hand. I'm not sure you answered this, but one question I have for you guys. Nobody has talked about authentication using a selfie. Is there any resistance in Africa against that? I mean, it seems to be popular in Western countries. You've got a phone, you take your selfie, you don't touch anybody. It's a low security. It's better than nothing. You can put in your Huduma number and then get a selfie. What do you guys think about that? I mean, Grace, you have experience with that. Ruben, anybody that wants to comment about that? And then let me start with Udehi, because I will combine the two. Udehi, let's go with you, and then we'll go, Grace, Nigeria, and anybody else.
The Ministry of Foreign Affairs here in Ethiopia uses the selfie authentication for power of attorney. For Ethiopians who live abroad, they can take a video selfie saying, I assign Mr. X, Mr. Y to take care of my business here in Ethiopia, that kind of thing. So the video power of attorney assignment and such things are, there is some experience here in Ethiopia. The other question, I'm sorry, if you can repeat, Doctor?
No, I thought you raised your hand, whether you wanted to add to the conversation that was taking place about authentication, but you said that selfie authentication is happening in some applications, like power of attorney. If you don't have anything else to add, we can move on.
Yeah, so, that would be.
Yeah, Grace.
I think we need to understand how African countries are. The biggest population, for example, in Uganda, that want to transact or want to receive a basic service will not have the ability to take the selfie, will not either afford the device or how to use the device, even if they had the device. So they will need help. Still, social distancing is violated in that case. So as we look at this, I think we need to consider the environment in some of our countries. So that's why we need to also look at more of a system integration. Most of the systems we use, if they are able to integrate with the national ID and agree to use the national ID number as a key identifier in all services, then I think we are able to eliminate fingerprint authentication. Yes, because in Uganda, actually, there is we are working on the process so that we have a centralized EFIS, so that we don't have different MDAs paying for the EFIS licenses. Once this person is being identified in one center, all the information should be accessed from that center, should be updated at that center. Luckily, our law allows us to share information. Of course, we look at the privacy. We must get consent. We shouldn't share at a certain level, but just to be able to receive a service so that you're able to use an app on your phone and then access a service. But when it comes, it's a good idea, but I think it will selfie will serve just a small population.
Okay, so inclusion will not happen. So here's what I heard. I heard basically in the post-COVID era, or while the COVID pandemic is happening, we have to continue enrollment. Social distancing has to be implemented. Cleaning in a supervised way has to be completely implemented as we bring in multimodality, which will start to have an impact in the next 3, 4, 5 years, if you like. In the meantime, for authentication, we can use selfies. That's fine, but it's not going to give us the big impact. Maybe for small, low-risk transactions, a digital ID or a digital ID number, and with an integration with the national ID, maybe a security question, maybe a PIN, could be enough to allow somebody to get access to a service that they're asking for. So without having to solve the problem of contactless biometrics. Does anybody on the panel have an alternative view? Yes, please, Nigeria.
Okay, thank you very much. When it comes to authentication, I used to think that is where the milking of the cow, like in Africa, everybody wants to milk the cow. But most of our problems, like say Nigeria, because we are a bigger country, is the enrollment that is really our own major issue. But when it comes to authentication, we have already put the back end. We put in the APIs that will allow only the NIN. You can put only the NIN, or you can put a combination of demographic information, or you can put only the face, or you can use the biometrics themselves. And then currently also we have the mobile ID, and also we have a QR-based digital ID slips, which can be used for authentication. But this COVID-19 has not only created an appreciation and value for the inclusive digital identity, but it has also spurred the conversation on how, like NIMSI, should be empowered and supported to accelerate the ID coverage and provide the foundational ID system required for planning, development, and management of future issues and also pandemics. And also that the NIN, we have separated the NIN again from citizenship. So the NIN is just proof of who you are. So it does not confer citizenship. So that people now recognize that the digital ID is an important benefit of the foundational ID, is the ability to respond quickly in the face of disaster through the use of the register to manage distribution of food, disbursement of palliatives, and even allocation and distribution of vaccine if it's if it is needed. So there are discussions around ensuring we learn lessons from this pandemic and work with all the stakeholders to have the national ID data that can be leveraged as the single source of truth for the functional ID to ascertain eligibility for beneficiaries of services, schemes, or transactions as we have it. So the authentication is the easiest part of identity management, but rather getting the identities and in multiple models is much more
it's the enrollment. Now, okay, well said. But let me point out another. In this transition into a dematerialized world, some would argue that COVID thrust the world 10 years into the future by trying to dematerialize things. It's dematerializing the work. We're working from a distance. It has dematerialized temporarily ID for Africa. So we're now having a discussion via Zoom. But there is, as generators of identity and even financial institutions, we produce still two materialized elements that circulate in populations and which are potentially carriers of contagion and infection. One is the physical ID card, and the second are currencies. So the question I have for the panel, and it's open for anybody, raise your hand if you want to discuss it. What do you think is the future of the physical ID? Will it be less important? Will it be the same? Or will we simply skip it altogether? Anybody wants to comment? Maury, do you have any perspective?
I don't think that we will skip it, but it's definitely on the way out. There are some realities that Africa has that make it that the credential has a value in the mentality of people. So even though we may be pushed to a more digital way of identification, validation, or authentication of identity, the use of credential is going to take a little longer.
You're not ready for it. Simply, you're not ready for completely dematerialized. That's what you're saying.
Believe.
Yeah. Anybody? Yeah, Nigeria. What do you think? Yes. DJ Aziz.
Yeah, I think it will take a long time before we eliminate the card, because the card is in the psyche of people. But we should also be mindful, like the experience from India with the Aadhaar. They enrolled 1.3 billion people and they did not give any single card. So when you discuss with the political leaders and the economical leaders, they will not be pointing at you to that direction, so that if you can't, and if we improve on our digital infrastructure, I believe that we should be able to use the digital identity sooner than later. But the general public wants the plastic. So, and in some places it is like a pride. I spoke to elderly people and young people that have the national ID. They think that it is a high pride, that they need it, they can pay for it. So before, like us, we used to give it free of charge, but now people are clamoring that they will pay for the card. So it is.
So there is a future for the physical medium, and then basically somebody's taking your ID card. They need to make sure they're wearing gloves or maybe protecting themselves from that regard. I saw Grace and Ruben agreeing with what you're saying, so I assume we will grant them that agreement. And I want to move on to another aspect which may be controversial. But before I do that, do I assume that the same applies to physical currency? I mean, basically, are people in Africa hesitant to take money? I mean, here in France, for example, for a while, I could not go to the supermarket, and the supermarket would refuse to take actual cash. They would say, no, you gotta give us contactless. So now they relaxed a little bit, but is that the case in Africa? Anywhere where they insist that it's M-Pesa, for example, Ruben, are there places which say, I want contactless, I don't want to touch anything from the currency point of view, which is a vector of contagion? Any perspective? Grace, yes, please.
I think COVID, during this period, we've seen a use of mobile money platforms a lot.
Go on.
And even those that our banks have integrated with mobile money, so you can access your mobile account by use of a USSD and you transact. And of course, there is a fee to that. So when you go to a market and you want to pay the lady using mobile money, they don't really resist, but they will ask you to add a top-up for charge, which is fair enough. So I think we are kind of adapting. We are moving to that, and there's a level of acceptance.
Okay, I think that's interesting. I want to raise a controversial subject, and I'm sure Mohammed is going to have something to say about this. So get ready. Some organization, some people in the world have argued that we need a special ID related to COVID, special health ID. If you like, you can call it immunity certificate, or you can call it a health passport. And I think I'd like to hear from the entire panel, because I think this is a subject that is going to have different perspective depending where you're coming from. I don't want to put you on the spot, Mohammed, but what do you think of that proposal? Do we really need an immunity certificate, a digital ID for COVID?
Yeah, I'm well placed to talk about it, because actually in Senegal, I was designed by the community to lead what we called a provisional digital identity, to use digital identity to provide public services. It is a provisional digital identity that people can use to access public services. And actually in Senegal, we have started the process to build a new digital identity to help people to access to public services at home.
Right, but this has nothing to do with COVID. You still can have a health ID like in France, for example, but I'm talking about, yeah, that's good, but should we be linking it to COVID?
Yeah, actually, because it is a provisional, because we need to have a quick solution to face the situation. That's why we call it a provisional digital identity. This digital identity can be provided from the national identity number, but also from the mobile number, because all the mobile phone number in Senegal as provided from the national identity number. And actually, we are working on this scheme to implement the digital identification, what we call the provisional digital ID for the Senegalese people to access to public services. I would add to the precedent questions, the fact of leaving the physical card only depend on the capacity of our government and public sector to deliver digital services. The example of Senegal, and related also to digital currency, the government decided to close all the offices for electricity and the water companies. And people are obliged to pay by e-wallet or digital payment system. And if the government decided something, every people are obliged to do it. So the capacity and the feature of the digital identity of the digital money in Africa, I think it only depends on the capacity of our government to deliver digital services.
Okay, so anybody else wants to comment on this topic? Do you think we need just like yellow fever certificates, do we need COVID certificate? Yes, please. Nigeria, DJ Aziz.
Well, you know, health ID is one of the functional identities. And I believe that if I can go to my doctor and he wants to know my history, he wants to help me but he needs some form of that kind of ID. But if I'm traveling, I want to enter Cameroon and the passport officer is asking for my health ID, then I will frown at that. Or if I go to the bank and they want to know my health ID before they can give me, transfer money to me, then that will be an issue. So the point is to have the foundational IDs that are linked to functional IDs, and the fact that one has been given also a clean bill of health today does not remove the exposure or risk of contacting COVID in the next 1 hour or 2 hours. So we have to be careful. We have to look at the long term of how the card can be used. We have been using even in the NIMSI ID card, we have an applet for the e-health, but it has never been used. So those privacy and security there are more concerns there than other things. So, but as a functional ID for the health sector, fine and good. Your doctor also needs to get more of your information to act on. Thank you.
Yeah. Actually, great. We have 10 minutes left. I wanna cover very quickly a couple of touchy subjects as well. Funding in the downturn of economy in Africa. What is your perspective as a panel regarding the funding situation? Will it stay flat? Will it go up? Will it go down? And how do you worry about funding? So I want this the whole panel. Maybe I can start with Ruben. Ruben, do you worry about funding in the economic crisis that's following the COVID?
Yes, sir. I think, like I mentioned earlier, the scare and the alarm which a lot of Kenyan citizens had when the epidemic was first reported is waning down. And a lot of people have a wish of getting things moving, especially because of the economic problem. And what I'm foreseeing, and maybe we could be having a major pronouncement by the end of this week, is where the country may, to some limited degree, try to get back to business, identity business, commercial business, and all that. And the identity movement will still play a very big role. And maybe let me also come back to a question I asked earlier about the role of identity as I foresee it in the future. Not only in Africa, even over the world, identity will continue playing a major role. With the major problems you're having, terrorism, the global economy, and even in Africa, we have come up with an African economic unit where people required to be identified. So I can foresee with the safeguards in terms of the health safeguards, we'll come up with some program whereby identity movement will still continue, economic issues will still continue, but of course with the safeguards. And I can see identity even playing even a major role.
Okay. So you're not worried at night about funding. So I'm going to go to Ethiopia. Udehi, you have plans to launch a program on identity. Do you think that froze, the COVID has frozen your planning, or do you think accelerated your planning? Very quickly, please, so we can fit everybody.
COVID may have decelerated other issues, but with regards to funding, there is no lack of it. Both from internal sources, there are different sectors such as the commercial banks who want to avoid financial fraud and who want to contribute to this project in any way they can. But also from outside, from abroad development partners, we do not have any shortcomings in that direction.
Okay. And anybody else on the panel who has a different perspective? Maureen, do you want to say anything about funding? Is funding uncertain in these economic times, or is it certain?
In terms of the identity entities, I don't think so. I don't think some funding will be affected. On the operational level, definitely it has affected the deployment execution. I may be worried a little bit more in the long term because it had an impact on the global world economy. So it will have to be affected at some point. In the short term, I don't see any impacts as of yet.
Okay, Grace?
I think it has been affected because priorities for the country are different now. Now there is more focus on health. So some of the planned activities have to be delayed so that the focus now is, the focus right now is on saving the people. So there are like building hospitals, a number of interventions government is putting up. So a number of planned activities, yes, have been affected, but moved to the near future.
Okay, actually, I want to get William's perspective, not on the impact of general ID, but on civil registration. What do you think has the impact of COVID-19 on CRVS funding?
Yes, in Mauritius, I'm glad to say that there has been no negative impact. Impact. Because of the COVID, because we had earmarked funds, and funds were earmarked for the revamping of the national identity card system, for the purchase of new blank cards, and for the renewal of personal printers of cards, because they were all end of life. And I'm very pleased to say that government in the budget that's going to be voted tomorrow has approved these funds. So as far as the modernization of the whole system of civil registration and national identity card is concerned, we're not going to be affected, thanks God.
Excellent, excellent. Mohammed, give us a perspective from Senegal. What do you think the funding looks like for ID-related programs, including what you do? Unmute, please. Mohammed, unmute.
Okay. Naturally, in our sector, we are a priority sector.
Right.
Funding is not affected. We have the phase that we'll have fund to continue our project. Even we was affected at the starting of the pandemic because no one knows have any information about the pandemics. But now we have more information about the pandemics. We have now a strategy to put in this context, and all the partners give us guarantee to continue to fund us and to help us.
Excellent. I want to ask a pointed question to DJ Aziz. I hope, DJ Aziz, you forgive me if I'm putting you on the spot, but I think you have the shoulders to hold that weight. Let me ask you, do you think identity authorities such as NIMSI should have been recognized by governments as essential services in the country?
Well, I believe that they are essential services, and like we had to maintain the back end, that is the database running, so that the authentications have to be happening during the pandemic, and also it is.
But enrollment, didn't enrollment get stopped during the pandemic?
Enrollment have to stop because everything stopped. And it is now that we are working out modalities to go back to it. And also when you talk of even the funding too, as you know that for a long, the World Bank have approved the funding, and we've been looking forward to the inaugural meeting of the steering committee, and that is going to happen this Friday, and it involves all the ministers from education, health, and finance, and the communication and digital economy. so that we will move this project forward. So, and from my own experience, anytime that something happens, like even this year, when we are talking about exam malpractices and trying to enforce the need on it, the moment that there was issue and we stopped it, then the US came up with a travel ban for certain categories in Nigeria. So identity came in again. And immediately while we are working on this one, then the COVID came in. So identity, even if government have not done anything, other events will force the government to recognize that identity is important. It needs to be focused in all the funding, because it is the foundation. You have to, when you are building a house, you must have a foundation. And it so happens that we have grown without that foundation. So it is a essential services, and the chairman of the COVID is also our own chairman for the Thank you.
So excellent. I'm sorry to interrupt you because we came on the top of the hour, and I want to say, you heard it here, identity is essential service, and we need, as a movement, ID for Africa, to continue to push for the recognition by governments, because the world is filled with risks, filled with events, pandemics, and events that are disruptive to the economy, disruptive to the lives of people, and without strong identity that can help us build social protection nets, that can help us allow people to get access even when buildings are inaccessible, we will be missing an opportunity, an important opportunity in development. So we could continue this discussion for another several hours. I can guarantee you, I will apologize sincerely to all of those who submitted fantastic questions. You can imagine how difficult it is for us to answer all of your questions. We've only touched the surface. I hope you enjoyed this session. You found it very interesting. So if you did, join us on the 17th, where we're going to continue this discussion, but from a different perspective, bringing in agencies like the World Bank, like UNICEF, UNDP, UNECA, and the Center for Global Development around basically the topic of what has changed in the development agenda as a consequence of COVID. So we'll continue this together, and I hope we will be in a position to be in person together, because I really miss you all. I really miss the energy that you've given me. You've given me a little bit here via this medium. Thank you for that. But I think nothing will replace the energy and the success of the upcoming ID for Africa in-person meeting. So let's hope this will happen very soon. Until then, we will see you on the 17th for the continuation of this webinar series. I thank the panel for their participation, and I'm obliged to end the session here. Thank you.
Thank you, Doctor.
Thank you.
Thank you, everyone.
Bye-bye.
Be safe, everybody. Be safe.
Be safe.
Be safe. Yes.
Be safe.